Okay, omega-3 for joint suppleness and just mobility of the joints. Is that correct?
Yes, that's correct, yeah.
Yes. Okay, omega-3 is very good.
Okay.
Providing you're not allergic to any fish oils or shellfish oils or anything like that. You're not allergic, are you?
No, not at all.
Okay.
But I do take calcium supplements.
You do. They're good. You can take them in conjunction with your omega-3.
Okay.
Omega-3 is natural, and what it does, it just lubricates your joints.
Yes, okay.
So you don't get that stiffness, and it keeps them, obviously when the lubrication goes, that's when the friction starts, and that's when the pain starts. So they're good, and they're very, very good as a preventative as well.
Okay.
So you keep taking them. They're good for your health anyway. It's as such, but some people do sometimes, I've had one or two people come to me, and they do say, the capsules, the oils or the capsules irritate their stomach. So what I always suggest with that is that you take them with food or after food. I would say you would need to take these for a while because they're a preventative. So the earlier you start taking them, the better. They've got a lot of benefits, obviously, with your joints, but they're good for your skin, they're good for your nails. They're saying fish oils are good for the brain, especially in children. They're good for brain development. So they're good to take as a preventative, but they do take a while to kick in. That's okay. Can I just say, if you are looking for something for your joints, there is something called chronodantin as well, glucosamine and chronodantin.
Okay.
You can get that from the chemist. They come in capsules where they're both incorporated into one capsule, and they're very, very good for joint mobility as well. Hey, Peter, is it runny eyes? Is it runny nose, sneezing?
Runny nose, sneezing mainly.
Runny nose and sneezing. Okay, what are you using at the moment?
It's not currently about myself. It's about my one of my siblings. They use just over the counter.
Okay, how old are they, Mr. S?
15.
15, okay. And have you been to the doctor with this?
Yeah, the doctor's just recommended buying something from over the counter.
Okay. And did you want tablets or would you like a spray? Want to go on to maybe spray?
Yeah.
Spray. There's a number of sprays you can use. You can use beclomethasone.
Okay.
If you go to the chemist.
Okay.
And there's also something called fluticasone, which is FLUTICASONE. But if you go to the doctor and ask him about these, because she's 15, the doctor will prescribe it on prescription for you, so it saves you buying them.
Okay.
Because you're paying the prescription fees.
Okay.
So if you go to the doctor and ask the doctor about these, the doctor will look at her patient history and see whether they'd be appropriate to her. But if she does get nose allergies, runny nose, itchy nose, I tell you what is very, very good, Mr. S.
Okay.
If you get a little bit of Vaseline and line the inside of her nostrils with Vaseline, that will stop the pollen getting up her nose because it will stick to the Vaseline.
Yeah, I have suggested that, but she's like, I don't want to put Vaseline up my nose every day.
There is something else called Happy Nose.
Okay.
That if her nose is sore from all the rubbing, Happy Nose, it's like it's a Vaseline base, but it's got menthol in it, and it's got pine wood oils. It's got all the natural oils in it. So if she just puts that around the nostrils, inside her nose as well, it will help her breathe a lot more easier. And if her nose is sore, it will just soothe it.
Okay.
And again, it will catch the pollen before it goes up her nose.
Okay, brilliant.
Okay.
Thank you very much for your help.
Thank you.
Good day.
Bye-bye. Foods we can eat, the foods we shouldn't eat. We've discussed to have regular exercise. Not too much, even just half an hour every day makes a difference. What we haven't discussed is what other diseases are linked to high cholesterol. Now, if your cholesterol level is high, let's say, for example, the doctor diagnoses you and he says, okay, you know, your cholesterol level's a bit too high, you need to control it. The other health risk factors that can become involved are heart disease. I'm not saying this happens all the time, but generally they say heart disease, diabetes, high blood pressure, and obviously cholesterol. The four are sort of always linked. So let's say somebody has diabetes. If you've got diabetes, then there is possibly a chance that your cholesterol could go slightly high because of your diet with the diabetes. So you need to look at obviously controlling cholesterol and hence keeping all the other diseases away.
So,
suffer from diabetes and you think you may have a fungal nail infection or you think you may have athlete's foot, then please do go to your doctor, because diabetic sufferers need to be diagnosed by the doctor because you have circulatory problems anyway. So problems like athlete's foot, fungal nail infections, you need to go to your doctor, and then he will assess it and then give you something appropriately. Sprays to spray on your feet. You can, again, like I said earlier, powder, sprinkle that between your toes, sprinkle it into your socks, and that will make a lot of difference. You'll know how you feel because only you know your body. If you feel that you're very sluggish, or you just haven't got the energy, or you're sleeping a lot more than what you normally sleep.
And also you're putting on weight.
You're putting on weight, or maybe you're eating loads and you never put on weight. So you can either be overactive or underactive. You need to go to your doctor because it could be a number of things. It could be underactive thyroid, it could be overactive thyroid, you could be anemic.
Yeah.
If you try not to wear tight-fitting clothing, make sure your clothing is loose so air can circulate down there, and hence stop bacteria breeding and bacteria growing. So they're little things that you could do at home. If you find that your cystitis is severely bad, then please make an appointment. Go to see your GP. If you can't get an appointment with your GP, then you can go to your chemist. There's a lot of products available, but you have to be careful if you go to your chemist, and you have to make sure that you're not on high blood pressure tablets, because a lot of the products come in sachets, and a lot of the sachets are very high in salt, in sodium content. So please just be careful on that. But Dr. Grish wants to just tell us a few things. And also, doctor also said, if a male complains of cystitis, he needs to go and make an appointment with his GP straight away. Perfumed soap, clean yourself down there as often, cotton underwear, lot of water, try to avoid tea and coffee, lot of cranberry juice. Jess said, Dr. Nabola, drink a lot of cranberry juice. If you find that you can't drink cranberry juice, then you can get the capsules from a health shop. Let it get as much air as possible, and the symptoms should alleviate themselves. But if you find that they don't, and after a couple of days it's still quite persistent, so then please go and see a doctor. But if only when you talk about depression can you actually move forward and try to treat depression. Depression is very, very, very common. It's as common as a headache these days.
Share your feeling.
Share your feeling. Very, very depressed, then please tune into our show. I will make you laugh, and Dr. Grishy's jokes will definitely make you laugh. So we've discussed quite a few topics today, Doctor.
Yeah.
We've gone through conjunctivitis, we've gone through allergy eyes, we've gone through dry eyes, ear infections, throat infections, cystitis. How many weight loss ki baat? We'll see you next week. Take care, have a good weekend, and don't forget, stay healthy and stay happy. Bye-bye.
Bye-bye.